Hi, I'm Kristina Hong of the Antelope Valley Healthcare District Board of Directors, and with me I have Betty Hull, our Emergency Department Director, and George Rowerdink, our Facilities Director. We're here to speak to you about the GEO bond measure that could possibly give us $350 million to the hospital. So George, if you'd like to explain how that would help the hospital and why it's needed.
Well, Antelope Valley Hospital was built in 1954, way before the earthquake standards that we have in place today. The hospital is too small, doesn't meet our needs, and we have an extensive construction work that needs to be done in order to meet these current needs. The amount of work that needs to be done by 2030 is going to cost us over $400 million.
So there's been a lot of discussion about a proposed new hospital and how many beds we would have in that hospital versus how many beds we have in our current hospital. Can you explain why that would make sense given that the new hospital proposal would actually have less beds than we currently have now?
Sure. Actually, the Women's Infants Pavilion currently is not going to be affected by the retrofit or the earthquake standards, so we don't have to touch those. Those beds are about 100 beds. The new proposed hospital will be around 230 beds. That would leave us with about 330 beds. With those 330 beds, it would basically meet our needs and take care of the needs we have. Currently, we have about 175 patients in our beds right now every night. So we would actually have additional space available for the future if we built a new hospital.
So if for some reason we didn't have the funds to build a new hospital, how would Measure H's bond money help us with this facility? What could we do as far as building?
There's several options. We could actually build onto the ER. We could build onto the ER with a tower above it. We could expand next to the hospital with a tower. But there's certain things that have to be done to meet current codes and standards. So it's important that we get the money so we can able to keep the hospital up and running and meet the needs for the community.
So you brought up the ER, and with that, Betty, if you could explain to us what the ER would be doing with this Measure H bond money and explain the efficiency of the ER as your goals.
Well, it's really a great ER. We have great physicians and we have a great opportunity here, but it's been a concern for a long time for the community because it's so extremely overcrowded. And when we look at it, we are looking at ways to care for our patients and their families by having a better way of doing it more efficiency with more space. So by retrofitting or getting a new hospital, we could actually have more space, provide better care, and continue to serve the community with our vision and mission of compassionate care and medical excellence. If we were looking at just trying to know how our ERs can be so challenging for patients, we just really want to give them the best experience we can by having this more space.